Hello everyone and welcome to our digital annual general meeting. My name is Luca Badioli and I am the CEO of the Arun Chichester Citizens Advice. Today I will be delivering a presentation reviewing the year that has just passed and a bit of the current situation. I will be talking about our 2019-2020 performance, changes to our delivery model, the new projects, and how we reacted through this COVID period. I will start with our performance. During the last tax year, we helped 9,800 people with 23,925 issues and gained £1,441,545 in financial outcomes for our clients. We dealt with 9,414 benefit inquiries, 3,067 debt inquiries, 2,384 housing inquiries, 1,849 employment inquiries, 1,525 relationships and family inquiries, and 901 health and community care inquiries. These are just the top 6 inquiry areas. 56% of the people we helped were females. 44% had either a long-term health condition or a disability. 8% were from ethnic minority groups. The highest age group were people from 50 to 69 years old. 10,071 inquiries were made by attending our offices. 5,494 by phone and 2,348 via web chats, email, etc. I will now be covering changes to our business model. In Littlehampton, we changed the way we deliver our service, and instead of waiting for people to come to our offices, we set up 2 hubs where people dropped in and sought advice. These were at the Littlehampton Library and the Chilgrove Community Centre. We also had the ability to use various outreaches to book appointments in case people had more complex issues. We made sure the outreaches were strategically positioned so that they covered all of the Littlehampton area and also certain groups such as survivors of domestic abuse, people accessing food bank, or the local job centre. We also had a separate back office at the lodge to deal with our advice line and web chat demand, and for our supervisor to be able to provide remote supervision. Other changes we made were moving from having part-time administrators at each office to administrators delivering their service 9 to 5, Monday to Friday, remotely from the Bognor Regis office. To make things easier, we updated our telephony system to a voice over the internet phone system. We have also changed our management structure from having a CEO, a finance manager, and an operational manager supported by 2 team leaders to having a CEO, finance manager, operational manager, and a project manager. We've also realized the need to improve our communication, research and campaigns, and towards the end of the year, we recruited a campaigns and communication manager. We did start delivering numerous projects last year. In July, we started delivering a new social prescribing service at medical centres in the Rustington, Angmering, East Preston and Littlehampton area. Thanks to the National Lottery, we were able to expand our own visiting service so that everyone with a disability or caring responsibility who was unable to access us through the normal channels will still be able to access advice and assistance on all type of inquiries. Thanks to a private donor, we were able to set up a new advice service for people with dementia at Sage House. Together with various partners, including Chichester District Council and the Richmond Fellowship, we started tackling digital exclusion through the Technology Doesn't Buy program. In collaboration with My Sister's House and Safe in Sussex, we piloted a financial capability service to people who are survivors or suffer domestic abuse. Thanks to Your Energy Sussex, we are able to start distributing fuel vouchers through all citizen advice offices within Sussex and Brighton and Hove. Last but not least, thanks to Sussex Community Foundation, we were able to pilot a service aimed at developing children's opportunity through advising and supporting their parents to deal with any advice issue that concerned and worried them. Finally, I will be explaining how we managed during this pandemic. Before the national lockdown, and due to the social distancing guidances and the high risk of infection to vulnerable groups, on the 19th of March, we stopped delivering our project funding services. And on the 20th of March, we closed our offices to the public. Before the Prime Minister made the announcement that the nation had to lock down, we had a COVID-19 response team set up and a plan on continuing to deliver a service during a lockdown. We set up a new home working service, embraced the use of technology to make us more effective during this period. We had to deal with huge demands with a skeleton volunteer workforce. We set up new services such as topping up prepayment meters for people who were shielding or social isolated. We showed real resilience in adapting to make sure that the community continued to receive the advice they desperately needed. And we also set up a group to look at the opportunities the situation was creating. At the moment, due to the continuing increase of infection rates, we have suspended our phased reopening of the face-to-face service. We are continuing to monitor the situation and review this. And we are also exploring alternative options to make sure the most vulnerable are still able to continue to receive our service. During the period between the 23rd of March and the 22nd of September, we have dealt with 4,290 benefit inquiries, 2,026 employment inquiries, 1,461 housing inquiries, 739 relationship and family inquiries, 693 debt inquiries, and 537 health and community care inquiries. 58% of the people who sought our services were female. 33% had a long-term health condition or disability, which is a reduction, and we are currently monitoring this, as this could be a consequence of many people currently seeking our services or of the extra support provided by the government to reduce financial hardship. 13% were from an ethnic minority group, which is an increase of 5% from last year, which reflects the national trend of BAME communities highly affected by the pandemic. The age group that most assessed our service were the 30 to 34 years old, compared to the 50 to 69 years old last year. 6,157 inquiries were made by phone, 1,697 through web chats, and 1,308 by email. We have helped 6,327 people with 11,989 inquiries and gained a staggering £1,461,372 for our clients, which is more than all of the last year. This shows how hard our team have worked during this period. On behalf of the management team, I want therefore to take the opportunity to thank our staff and volunteers for their continued hard work and dedication. Thank you.